this body. The gentleman from Massachusetts, Mr. Markey, for 2 minutes.
The gentleman is recognized for 2 minutes.
The Republican plan is really quite simple. You're on your own. The Republican plan tells Americans if you get sick and you don't have insurance, you're on your own. The Republican plan tells Americans if you are denied coverage because of a pre-existing condition, you're on your own. The Republican leaders in Washington seem to be suffering from their own pre-existing condition, a heart of stone. If you kicked them in the heart, you would break your toe. They say that the Democratic plan will put the government between you and your doctor. But the doctors who make up the American Medical Association support the Democratic bill and not the Republican bill. The Republicans claim the Democratic bill will hurt seniors, but AARP has endorsed the Democratic bill and not the Republican bill. Why does AARP support the Democratic bill? Because the Democratic bill will close the Medicare Part D donut hole for seniors. The Republican bill does not. We provide support for low-income seniors. They do not. We will extend the solvency of Medicare. They do not. Right now, 60% of all bankruptcies in America are because of medical expenses. Democratic bill makes sure that never happens again. The Republican bill does not. You know, the GOP used to stand for Grand Old Party. Now it stands for Grandstand, Oppose, and Pretend. They grandstand with phony claims about non-existent death panels. They oppose any real reform. And with this substitute, they pretend to offer a solution while really doing nothing. GOP, grandstand, oppose, and pretend. And make no mistake about it, the Republican substitute is not real reform. It does nothing to curb skyrocketing health care costs. It does nothing to provide real insurance coverage to millions who are now uninsured. It does nothing to stop the unfair practices of insurance companies. I urge my colleagues to vote no on the Republican do-nothing substitute.